Welcome to HIV, Hepatitis C, and Recovery, the Safe Recovery Project. When we say someone is in recovery, what do we mean? What are they in recovery from? Addiction, yes, but more accurately, the person is recovering from drug-related harm. Recovery means learning how to heal from the harm you have already experienced because of your addiction. It's about figuring out how to limit or stop harm that is happening to you right now because of your addiction. And it's about figuring out how to keep yourself from experiencing more harm in the future. As you learn about HIV and hepatitis C today, please keep a recovery mindset. Think about HIV and Hep C as drug-related harm and figure out how you can keep HIV and Hep C from hurting you. HIV and Hep C are preventable. If you are already living with HIV or Hep C, focus on how you can best limit any harmful effects of the virus to you or others. Focusing on keeping yourself safe is even more important if you are still using. And thanks to your new knowledge, you can choose to keep yourself safer from HIV and Hep C today, whether or not you are using today. That is what it means to have a safe recovery. Many people become infected with HIV and Hep C through injection drug use. Injection drug use is one of the most common ways that people become infected with HIV, and it is the most common way that people become infected with hepatitis C. This presentation will focus on ways to keep yourself from getting infected with either of these diseases and what to do if you already are infected. Both HIV and Hep C can be spread through contact with infected blood. To avoid becoming infected with HIV and Hep C, you should avoid contact with others' blood, and you should always help others avoid contact with your blood. HIV and Hep C can be passed when blood from an infected person enters the body of another person. When people are injecting, blood is present. There may be small amounts of blood that you can't even see, but it's still enough to infect someone. You can become infected with HIV or Hep C if blood from an infected person gets into your body when you inject. This can happen when people share injection supplies like syringes, cookers, spoons, cottons, water, or drug water mixes. This means that to avoid becoming infected, you should always use a brand new syringe, cooker, and cotton every single time. You should never share your syringe, cooker, cotton, water, or drug water mixes with anyone else, and you should never dip into the same cooker or spoon as someone else, even with your own needle. Don't reuse your own syringes, cookers, or other injection supplies. After they are used once, they are dirty and can cause serious illness like septicemia or endocarditis. Reusing needles is also bad for your veins. This picture shows the damage done to the needle point after only 6 uses. Don't share syringes, cookers, or other injection supplies. Sharing supplies can pass bacteria and viruses like HIV and Hep C from person to person. Cottons or filters can't be cleaned and should never be reused. Reusing cottons can cause cotton fever and bacterial infections that are sometimes fatal. Sharing cottons can transmit HIV and Hep C. Always use a new cotton once and then safely dispose of it. It's legal to buy syringes over the counter at a pharmacy in Vermont. However, you should know that it's also legal for a pharmacist to refuse to sell you syringes. In Vermont, you also have another option. You can get free syringes at a syringe exchange program like Safe Recovery in Burlington, Vermont Cares in St. Johnsbury, or the Good Neighbor Clinic in White River Junction. Syringe exchange programs are legal, free, and you don't have to give your name. Syringe exchange programs like Safe Recovery provide free syringes. They can also give you other safer injection supplies like cookers and cottons, and they can also help you out with information, advice, and practical support. You can get free hard plastic sharps containers at Safe Recovery. You can put your used syringes and other injection supplies in the sharps container and return it to Safe Recovery for safe disposal. Sharps containers may also be available at other syringe exchange programs in Vermont. If you would rather dispose of your used syringes and other injection supplies in your household trash, we have stickers to place on your own plastic container, like a soda bottle or a detergent bottle. You simply place the sticker on the bottle and dispose of it in your trash. Just make sure you cap the bottle. If you don't have a sticker, then you should write the word sharps on the outside of the bottle. This will let people who process the trash know not to open the bottle or recycle the bottle. It feels good to know that you are disposing of your used supplies safely. Using a syringe, cooker, or cotton more than once is not safe. Never reuse or share injection supplies. Always use brand new injection supplies once and then safely dispose of them. If a new syringe or cooker is not available and you are going to inject with a used syringe or cooker in spite of the health risk, you can reduce your risk by cleaning the syringe or cooker with bleach. Cleaning with bleach is not 100% effective in killing HIV or Hep C, but it will greatly reduce your risk of infection. To bleach a syringe, rinse the syringe inside and out with cool water to loosen and remove as much blood as possible. Cool water is better than hot water because hot can make blood clot and make it harder to remove. Then fill the syringe with full-strength bleach, such as Clorox, right out of the bottle. Leave the bleach in the syringe for 2 to 3 minutes while lightly shaking to loosen any dried blood and help to make sure the bleach is getting into every crevice. Squirt the bleach out of the syringe and then rinse the syringe inside and out with water to make sure you aren't injecting any bleach. Remember to dispose of the used bleach and water you used to clean the syringe or cooker safely. The water and bleach is mixed with blood that could pose a health risk to others. If you are addicted to opiates, medication-assisted treatment will reduce your risk for both HIV and Hep C transmission. Medication-assisted treatment includes methadone, Suboxone or buprenorphine, and naltrexone. People who are addicted to opiates and who are in medication-assisted treatment are less likely to inject than those who are not in treatment, and for this reason are less likely to become infected with HIV or Hep C. You can learn more about treatment and request a referral to a treatment program at Safe Recovery. Now we will talk about getting tested for HIV and hepatitis C. Should you get tested for HIV and Hep C? Yes. It's important to know whether or not you have HIV or Hep C. The only way to know is to get tested. You should be tested for HIV and Hep C if you have ever injected even once, if you are injecting on an ongoing basis, or if you don't know your current HIV and Hep C status. If you're injecting, it's a good idea to get tested for HIV and Hep C every 6 months. HIV testing is available at Safe Recovery and at other community testing sites across Vermont. It's anonymous and free. You can also get confidential HIV testing through your doctor. If you find out that you are HIV negative, you can take steps to make sure that you remain HIV free. You can choose to always use brand new syringes and other injection supplies once and then safely dispose of them. You can choose to use a condom when you have sex. If you find out that you're HIV positive, you can take steps to take care of your health and enjoy a long life. You can see a doctor that specializes in HIV treatment. With HIV medications, many people live long lives. You can also choose to make sure that you don't infect others with HIV. HIV and Hep C testing is available at Safe Recovery. It's anonymous and free. You can also get confidential testing with your doctor. If you find out that you're Hep C negative, in other words, you are not infected, you can take steps to make sure that you remain Hep C free. You can choose to use brand new syringes and other injection supplies once and then safely dispose of them. If you find out that you're Hep C positive, in other words, you have been infected, you can get follow-up testing to see whether or not you have developed chronic infection. If you do have chronic infection, you can see a doctor that specializes in Hep C care and treatment. With treatment, many people with chronic infection are cured, especially if treatment begins before the liver is badly damaged. You can also make sure that you don't infect others with Hep C. We've been talking about Hep C and HIV. We know that both of these diseases can be passed from person to person through blood during injection drug use. That's why it's so important to always use a freshie. Now let's take some time to focus just on Hep C. Hepatitis simply means inflammation of the liver. A number of things can cause the inflammation of the liver. Excessive drinking of alcohol, for example, can cause hepatitis. Hepatitis is also caused by certain viruses, which are named hepatitis A, B, and C. Hepatitis A, B, and C are infectious, which means that they can be passed from one person to another. You can prevent hepatitis by avoiding excessive drinking and by not getting infected with hepatitis A, B, or C. There are vaccines to help protect yourself from Hep A and Hep B. And while there is no vaccine for Hep C, there are ways to protect yourself from hepatitis C as well. Hepatitis C is a virus. The virus can be passed from one person to another and can be spread through contact with infected blood during injection drug use. Over time, the Hep C virus can damage the liver and cause health problems. In some cases, these health problems can lead to death. Hepatitis C is very common among people who inject in Vermont. Most people who inject already have Hep C. If you are injecting with another person, there is a very good chance that the person you are injecting with has hepatitis C. That's why it's so important to learn about how to prevent Hep C infection. People who have Hep C don't always look sick. This is because it takes Hep C a long time to damage the liver. People who have Hep C often don't even know it because they look and feel fine. Even though someone with Hep C does not look sick or feel sick, they can still pass the Hep C virus on to others. You can't tell if someone has Hep C just by looking at them. You can't tell if you have Hep C unless you get a Hep C test along with any necessary follow-up testing. The only way to know for sure if you have hepatitis C is to get tested. Hepatitis C can live on an exposed surface, like a spoon, for days, and inside a used syringe for weeks. Hep C can be passed when people dip into the same cooker, even if they are each using their own syringe. Hep C is passed through blood contact only. This does sometimes happen during sex. Condoms can help prevent blood contact during sex. Also, you can reduce your risk of Hep C transmission by avoiding sexual activity if blood is likely to be present. Blood is more likely to be present if you are having anal sex, rough sex, or dry sex. Blood is also more likely to be present if one or both people have open sores on their genitals, or when menstrual blood is present. You can become infected with Hep C if you have contact with infected blood. This is true even if the amount of blood is too tiny to notice. You may be able to think of some situations where this might happen. For example, when people share syringes, dip into the same cooker, or otherwise share injection supplies, blood may be passed from one person to another. This could also happen when people share straws or crack pipes, especially if lips are burned, cracked, or bleeding, or when people share tattoo needles or ink pots. It could happen when people share body-piercing needles or even during a bloody fight. Always be alert when blood is present. You should avoid any contact with another person's blood, and you should help other people avoid contact with your blood. You are at greater risk of becoming infected with Hep C if you already have an STD. This is because some STDs cause sores that may provide a point of entry for Hep C infection to get into your body. Getting certain STDs may also indicate that you are having unprotected sex with people who are themselves at higher risk of getting Hep C. This increases your chance of getting Hep C. Can I give myself Hep C by reusing my own syringe? No, you can't get Hep C from yourself. You can only get Hep C by coming into contact with infected blood from someone who already has Hep C. You can't get Hep C by reusing your own syringe as long as you are the only person who has ever used the syringe. However, you can get other infections this way that sometimes can be life-threatening, such as septicemia or endocarditis. Using injection supplies more than once is not safe. Always use a freshie. What happens when someone becomes infected with Hep C? In some cases, people who become infected with Hep C are able to fight it off on their own. Their immune system destroys all of the virus. They are no longer infected and they can't pass the virus to others. About 25% of people who become infected with Hep C are able to fight it off on their own without medical treatment. In other cases, people who become infected with Hep C are not able to fight it off on their own. Their immune system is not able to destroy all of the virus. They remain infected and they can pass the virus on to others. This is called chronic infection. About 75% of people who become infected with Hep C are not able to fight it off on their own, and they become permanently infected with Hep C. The only way they will ever be cured is with medical treatment. Some people think that if they already have Hep C, they don't need to worry about becoming infected again. This is wrong. You can become double infected with Hep C. Even if you are already infected with one type or strain of the virus, you can still become infected with another. There is more than one strain of the Hep C virus. Each one is called a type or a genotype. You don't want to be infected with more than one type of Hep C because having more than one type may make it more likely that you will experience liver damage and may make your hepatitis C infection harder to treat. Anyone can become infected with Hep C. Even if you already have Hep C and got rid of it, meaning you either fought it off on your own or fought it off with the help of medical treatment, you can still easily become infected again. You are never immune to hepatitis C, and anyone can become infected with hepatitis C. Now we will talk about living with the hepatitis C virus. If you have Hep C, you should avoid drinking alcohol. Drinking can greatly increase the chances that you will have serious liver damage in the future and can make it happen much faster. If you have Hep C, it's important to get vaccinated for hepatitis A and hepatitis B. You don't want your liver to have to deal with more than one kind of hepatitis. You should see a doctor regularly. In addition to seeing your primary care provider, it's a good idea to also see a liver specialist. It's important to see a doctor regularly, even if you don't want medical treatment for your Hep C. Your doctor can do simple tests to find out how you and your liver are doing. Your doctor can help you learn about whether you should consider treatment and what your treatment options might be. Medical treatments are available to treat hepatitis C. Hep C treatment works well for many people, and many people who get treatment are cured. But Hep C treatments don't work for everyone, and some people experience difficult side effects. Not everyone needs treatment. The only way to know whether or not you need treatment is to see a doctor. New and better treatments are on the horizon. Getting vaccinated for hepatitis A and B will reduce your risk of liver damage. Getting vaccinated for hepatitis A and B can help keep your liver healthy. It's a good idea to get vaccinated, especially if you already have hepatitis C. This can help protect your liver. You can get vaccinated for hepatitis A and B at Safe Recovery. It's free. There is no vaccine for hepatitis C, only for Hep A and B. The only way to prevent Hep C is to avoid contact with infected blood. That means never using someone else's syringe. You should never share injection supplies like syringes, cookers, cottons, ties, waters, or drug mixes. Always use a freshie. If you start Hep C treatment and decide it's not for you, you can stop treatment. You can stop treatment at any time. Hep C treatments aren't always easy, and some people get challenging side effects from the medication. If this happens to you and you decide you want to stop treatment, you can. Stopping treatment won't make your Hep C worse than it was before you started, and stopping treatment won't prevent you from trying treatment again in the future. Some people are afraid to get a liver biopsy, though really it's not as bad as it sounds. A biopsy is a medical test where a small sample of liver tissue is collected for testing using a long needle. Most people who have had a liver biopsy say it's not that bad. Your skin is numbed, it happens fast, and other than some soreness, most people say it turned out to be not such a big deal after all. Don't let a fear of a biopsy keep you away from a doctor or keep you from considering treatment for your hepatitis C. You can refuse a biopsy and still get other tests that can help you and your doctor monitor and take care of your health. And many doctors will treat Hep C even without a liver biopsy. Hep C is 100% preventable, yet people who are injecting are becoming infected. Lots of people. If you inject, you should always use brand new syringes, cookers, cottons, clean water, and other injection supplies every time. You should never reuse or share injection supplies. You should always avoid contact with other people's blood and help them avoid contact with your blood, especially avoid contact with blood while injecting. If you have ever injected, you should get tested for Hep C. If you test positive for Hep C, you should get follow-up testing to find out if you have chronic infection. If you are living with a chronic infection, you should avoid drinking alcohol and you should see a doctor regularly. You have the power to keep yourself safer from Hep C, and now you know how. We've been talking about Hep C. Now let's take some time just to focus on HIV. HIV is a virus. The virus can be passed from one person to another. If left untreated, HIV will eventually cause serious damage to a person's immune system so that they can't fight off illness very well. We say a person has AIDS once HIV has caused a person's immune system to become badly damaged and they start to get sick. HIV and AIDS can be fatal. Once you have HIV, you have it for life. Treatment is available to help people stay healthier and live longer, but there is no cure for HIV. People who have HIV don't always look sick. This is because it takes HIV a long time to weaken a person's immune system enough for them to start to get sick. Or the person may be taking HIV treatment medications that help keep their immune system strong. People who have HIV often don't even know it because they feel fine. Even though someone who has HIV does not look sick or feel sick, they can still pass the virus on to others. You can't tell if someone has HIV just by looking at them. You can't tell if you have HIV unless you get tested. Anyone can become infected with HIV. HIV is spread through contact with infected blood, semen, or vaginal secretions. HIV is usually spread through contact with infected blood, semen, or vaginal secretions during sex or during injection drug use. HIV can also be spread from an infected mother to her baby during pregnancy, delivery, or breastfeeding. You can become infected with HIV if you have contact with infected blood. You may be able to think of some common situations where this might happen. For example, when people share syringes or other injection supplies, blood might be passed from one person to the other. This could also happen when people share straws or crack pipes, share tattoo needles or ink pots, share body-piercing needles, or even during a bloody fight. Always be alert when blood is present. You should avoid any contact with another person's blood, and you should help them avoid contact with your blood. You can become infected with HIV if blood from an infected person gets into your body when you inject. This can happen when people share injection supplies like syringes, cookers, or spoons, cottons, or drug water mixes. This means that to avoid becoming infected with HIV, you should always use a brand new syringe, cooker, and cotton every time. You should never share your syringe, cooker, or cotton with anyone else. You should never share water or drug water mixes with anyone else. And you should never dip into the same cooker or spoon as someone else, even with your own needle. HIV can be passed from person to person when people dip into the same cooker, even if they are each using their own syringe. You can become infected with HIV if you have contact with an infected person's blood, semen, or vaginal secretions through sexual contact. This might happen during oral sex, vaginal sex, or anal sex. When we talk about safer sex, we're talking about ways to reduce HIV risk while having sex. You can reduce HIV risk by choosing to use a condom. You can also reduce HIV risk by choosing lower risky kinds of sex, such as oral sex, instead of higher risk kinds of sex, such as vaginal or anal sex. For oral sex, it's more risky to perform oral sex on someone else than to have someone else perform oral sex on you. And since anal sex has the highest HIV transmission risk, it's especially important to consider using a condom if you're having anal sex. If you have sex, the best way to keep yourself safe from HIV infection is to use a condom every time. You should use a water-based lube such as KY jelly with a condom because oil-based products like Vaseline, baby oil, or hand lotion can weaken the condom and make it break during sex. It's very important to know how HIV is spread. It's also important to know how HIV is not spread. HIV is not spread through the air or by casual contact. It's safe to be around someone who has HIV or AIDS. You can't get HIV through casual contact with someone who has it. After all, you're not in contact with their blood, semen, or vaginal secretions. You will not get HIV from eating in a restaurant, swimming in a pool, sitting in a hot tub, donating blood, or getting bit by a mosquito. You will not get HIV from a toilet, water fountain, or telephone. It's safe to shake hands or hug, and kissing on the cheek is safe too. Kissing on the mouth is not considered high risk because you can't get HIV from saliva. There is a possible risk of infection if a person has blood in their mouth and they have an open cut or sore in your mouth. You are at greater risk of becoming infected with HIV if you already have another sexually transmitted disease, such as herpes, HPV, chlamydia, gonorrhea, or syphilis. If you are exposed to HIV, there is a higher chance that you'll become infected with HIV if your body is already fighting off another infection. Also, some STDs cause sores that may provide a point of entry for HIV to get into your body. Getting certain STDs may also indicate that you're having unprotected sex with people who are themselves at higher risk for HIV, and this increases your risk of getting HIV. To repeat, if you are exposed to HIV, there is a higher chance that you will become infected with HIV if your body is already fighting off another infection. This is true with STDs, and it's also true with hepatitis A, B, and C. If you already have Hep C, it's especially important that you avoid becoming exposed to HIV. You can avoid becoming exposed to HIV by never sharing injection supplies and by using a condom every time you have sex. Getting vaccinated for Hep A and B can keep you from becoming infected with Hep A and B. Remember, if you're exposed to HIV, there's a greater chance that you will become infected with HIV if your body is already fighting off another infection. That's why making sure that you don't get hepatitis A or B will reduce your risk of becoming infected with HIV. You can get vaccinated for Hep A and B at Safe Recovery. It's free. If you are ever exposed to HIV, for example, you share a syringe with someone that you know has HIV or AIDS, or you are having sex with somebody and your partner is HIV positive and the condom breaks, you should know that there are emergency medications that you can take that can reduce your risk of becoming infected. These medications must be taken as soon as possible after exposure to HIV, usually within about 72 hours. So if you are ever in the situation, you should go to the emergency room and contact Safe Recovery right away. If you know you were exposed to HIV in the past, you should get tested for it so that you know whether or not you became infected with the disease. To summarize, remember that you can choose to have a safe recovery. You can choose to keep yourself safe from HIV and Hep C today, whether or not you are using today. If you inject, you can choose to always use a freshie. If you have sex, you can choose to always use a condom. You can choose to get tested for HIV, Hep C, and STDs. You can choose to get vaccinated for Hep A and Hep B. You can choose to get drug treatment, including treatment with methadone, Suboxone, or naltrexone. And you can choose to see a doctor regularly. Please let us know how we can help support you in your efforts to keep yourself safer from HIV and Hep C. We want to help. Thank you for listening.